Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to today's topic from the Nagamia Institute of Islamic Medicine and Science. I'd like to welcome everyone to a very exciting conversation about exploring Islamic medieval scholars' impact on gastroenterology, hepatology, and nutrition. Just to introduce myself, I work with Nagamia Institute of Islamic Medicine and Sciences. I live in the Chicagoland area. I'm an internal medicine physician. I also work with Hayat Relief Foundation and doing some nonprofit work around the world. So today's schedule, as it will go, we will start with the recitation of the Quran, a brief introduction to what Nagamia Institute of Islamic Medicine is, and then also a brief message from Dr. Nagamia, Dr. Adnan Muhammad, Sister Widad, and a Q&A session at the very end. Just to set the stage for today, I think this is a very timely discussion, considering we always hear you are what you eat. And for us, Ramadan is coming up. So a lot of us have heard this word intermittent fasting. When I was a kid growing up, fasting was a word that not everybody knew. So it's kind of become a more popular thing. And everyone is involved with thinking about nutrition now, your macros, micros, carbs, protein, fat, everything. But as everyone knows, science builds on each other from history. So I think today is a great time to learn some of those names throughout history that have contributed to where we are today. So that's where we'll start. We'll start with the recitation of the Quran by Sister Alia Herzella. She's the executive director at Nagamia Institute of Islamic Medicine and Sciences. And we will go to that right now.
Assalamu alaikum wa rahmatullahi wa barakatuh. Inshallah, I'm going to read from Surah Al-Alaq from 1 to 5. Bismillahir Rahmanir Rahim. A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. اقرأ باسم ربك الذي خلق خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم صدق الله العظيم. Translation. Bismillahir Rahmanir Rahim. In the name of God, the most compassionate, most merciful. Read, O Prophet, in the name of your Lord, who created humans from a clinging clot. Read, and your Lord is the most generous, who taught by the pen, taught humanity what they knew not. Sadaqallah al-Azim. Thank you, and Jazakumullah khair. Inshallah, it will be a great event. Jazakumullah khair. Assalamu alaikum.
Jazakallah, Sister Alia, and for all your behind-the-scenes work as executive director. We're going to jump directly to a little documentary video about NIMS right now.
Nagamia Institute of Islamic Medicine and Sciences, formerly known as the International Institute of Islamic Medicine, aims to bring alive discoveries and inventions in medicine and other sciences. Through exhibitions, storytelling, and modern technology. We are a network of academics, historians, scientists, and physicians with deep subject matter expertise. We are eager to share our knowledge to create experiences that produce a better understanding of the Islamic ethos and the contributions of Muslims to medicine and other sciences. We invite you to join us to promote a scientific mindset and to inspire excellence in generations to come.
Jazakallah for that presentation. Jumping right into the next part of the program, I'd like to introduce Dr. Nagamia. A huge debt to him for putting on this these events and this organization. Him and Dr. Tajuddin Ahmed have been helping bring more of these contributions from Islamic sciences to the forefront so all of us can benefit. Dr. Hussein Nagami is the Chief Emeritus Cardiovascular, Thoracic, and Cardiac Transplants Surgery Team at Tampa General Hospital in Tampa, Florida. He's also the Clinical Assistant Professor of Surgery, University of South Florida Medical School. He's also the past president, Islamic Medical Association of North America. He's on the members founder committee of Islamic Society of North America. He's also the founder and chairman of IIM, now known as Nagamia Institute of Islamic Medicine, and he's been very instrumental in a lot of organizations throughout the American Muslim history in the United States. So without further ado, Dr. Hussein Nagami.
Thank you, Shah, for that nice introduction for me. I have had the great pleasure of bringing to you these seminars from the Nagami Institute. There's a lot of work that goes behind, and I must thank all the, not only Alia, who's our executive director, who works very hard, but also all the board of directors who coordinate all the events. And mashallah, we have been gaining more international recognition. We have been having these seminars voiced in India, Pakistan, in the Middle East, and everywhere else. And we are receiving very nice comments in the sense that this is a subject which people have had not much knowledge about. And it is a great time to, in this day and age of webinars and being able to talk to the world at just one moment, this is great opportunity for us to learn about our own history. And that is the main purpose of the Nagami Institute. Our webinars in the past are all recorded and they are on our website. So please visit our website, www.niims.org. Again, sorry, www.niims.org. With that little introduction, today's subject is very exciting to me because, I mean, everybody has heard about our prophet, our beloved prophet, saying that it's very important about your eating habits, that when you eat, you should eat 1/3 solid, 1/3 liquid, and leave 1/3 of your stomach empty. That's such a wonderful saying. I mean, just imagine the impact that can have. And the impact was very evident even during the ancient times. I mean, during the Crusades, the Muslim soldiers were fighting so well that the Christian soldiers, when they came together, they asked them, what is the secret of your success, of this vitality that you have? So the Muslim soldiers said that, you know, the Prophet of Islam, our beloved Prophet, he told us that you should eat only 1/3, you should drink only liquid 1/3, and leave 1/3 of your stomach empty. And that is our secret. That's made us strong, and we can fight, and we can win the crusade. This was at the fall of Jerusalem. Can you imagine that, you know, this sort of thing could impact the whole society? But you learn more about it in this seminar, so I will stop there, and I welcome the presenters for today, Dr. Adnan Muhammad and Widad, who are very knowledgeable and mashallah will educate you on this subject. Thank you. Assalamu alaikum.
Jazakallah for that background. And just piggybacking off of what Dr. Nagamia said, just looking at through some of the slides that are going to be presented today and my own research a little bit on this topic, it's fascinating how much medieval Islamic history and just the Islamic history in general, when they talked about diet, something that I have not heard recently, they would do that in the current trends of like keto diets and carb fasting. is they used to do this in during the medieval times and different times throughout the Islamic history. Was they would do a personality index and get a sense of your mizaj, and then prescribe you a specific type of diet. So if you had problems with anger, they maybe introduce more yogurt or different types of things. There's so many fascinating things that I don't think we've even looked at again since then, but just to show you the depth that it was studied in the past. So without further ado, we'll jump right into our discussion today by Dr. Adnan Muhammad. He's a board-certified gastroenterologist and transplant hepatologist in Tampa, Florida. He is the associate professor of medicine at University of South Florida. He's a past president of the Tampa chapter of NIMS. He's an author of many peer-reviewed publications in scientific journals. Dr. Adnan, thanks for joining us today.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. First of all, I want to thank Dr. Nagamia and the Nagami Institute of Islamic Medicine for inviting me to give the presentation. It's been an honorable and a fruitful journey for me to be a part of this. When Dr. Nagamian asked me last year, 2020, to write a book chapter on this topic, which is very close to my heart, which is the contribution of Islam and Islamic medicine in the medieval area in the field of gastroenterology, hepatology, and clinical nutrition. So I humbly accepted the invitation. And I also asked my co-author, Widad Labban, who's going to give the presentation in a second, to help me out with this project. Doing this project was not easy one, because most important thing is that we have to make sure that everything which is being presented today and also which is a part of the book chapter, inshallah, is authentic and has been verified with peer references, and everything is all genuine. So it took a while. It took about 6 months time frame to gather all the information on this topic. We also get all the references which will be presented during the presentation. And we want to make sure that the information which has been conveyed today and the information which inshallah will become a part of the book chapter for a contribution of Islam and Islamic medicine in the field of gastroenterology, hepatology, clinical nutrition is the correct one. So, so again, I want to thank Dr. Nagamia and the whole organizers for giving us the opportunity to come today, do the webinar, and talk about this topic. In terms of the presentation, my co-host Widad Labban is going to give the presentation. She'll go over the PowerPoint presentation, and then in the end, inshallah, all of us will be here to answer your questions. So having said that, I will invite Widad, and Dr. Shahab will introduce her. Thank you so much.
Thanks for joining us, Dr. Adnan. Greatly appreciated. Sister Widad Labban, she graduated from the University of South Florida with a bachelor's in cell and molecular biology. She's a women's care nurse, as well as a volunteer coordinator for the ICNA Relief Tampa organization. She is currently applying to medical school with hopes of working in primary care. We will please join us, Sister Widad.
All right, Assalamu alaikum, everyone. Thank you all for joining. As mentioned, my name is Widad, and I'll be presenting in collaboration with Dr. Adnan. So our topic today is exploring Islamic medieval scholars' impact on gastroenterology, hepatology, and nutrition. We will be going over related prophetic medicine, listing scholars and their discoveries, and then discussing reflections regarding the research, and then opening up the floor to Q&A. So starting off with prophetic medicine, medicinal practices in the Islamic world can be traced back to the time of the Prophet ﷺ, between the 6th and 7th centuries. Prophetic medicine is an accumulation of sayings, actions from the Prophet ﷺ, as well as verses from the Holy Quran. It was used for treatments for the people of the Prophet's time, as well as people from beyond, and even today. It reflects a holistic approach to medicine, relying heavily on good nutrition and spirituality, and many of the practices of the Prophet that the Prophet was known to do for health and well-being have been proven to have great benefits in modern lifestyle today. So we'll be starting off with the fig. The fig is mentioned in the 95th chapter of the Quran, وَالتِّينِ وَالزَّيْتُونِ. Pretty short verse, but this verse can be interpreted in multiple ways. However, if we understood it for its literal sense, God is swearing by the miracle of the fruit that humans consume. Figs, specifically dried or raw, are extremely high in fiber. Increasing dietary intake of fiber lessens constipation, regulates the digestive tract, and reduces occurrence of hemorrhoids. Consumption of figs have also potentially shown to be beneficial in the prevention of certain cancers, such as esophageal and hepatic cancers. There are numerous studies out there that study the various extracts of figs, and it's been shown to display cytotoxic and anti-cancer properties. So as figs were sworn upon in the ayah, the olives were as well. The Prophet ﷺ also mentioned olive oil in a hadith that was narrated by Umar radiallahu anhu. Season your foods with olive oil and anoint yourself with it, for it comes from a blessed tree. Olives and olive oil is high in healthy fats, such as saturated fatty acids, which decreases LDL cholesterol levels and increases HDL cholesterol levels. Some studies have suggested that eating olives could prevent the cell growth of more than 25% of colon cancers as well. Now, honey, probably one of the top two ingredients that we think of when we think of prophetic medicine. It's mentioned in the Quran twice, in the 16th and 47th chapters. In the 16th chapter, honey is referred to for its healing properties, and the 47th describes rivers of honey that are in heaven. The Prophet ﷺ is also quoted at least twice, mentioning honey for its medicinal healing as well. There is one narration that a man had approached the Prophet ﷺ 3 times in regards to his brother's abdominal troubles. The Prophet ﷺ ordered the man to let his brother consume honey each time, and thus the brother was cured from his ailment. In another narration, the Prophet ﷺ had said you should take 2 that bring healing, honey and the Quran. It's also worth mentioning that the Prophet ﷺ used to enjoy consuming honey on a regular basis. What we know today, honey is well known for its multitude of antibacterial, anti-inflammatory, and antioxidant power. More specifically, honey can be a powerful ingredient to use in the prevention and treatment of gastroesophageal reflux, diarrhea, and gastroenteritis, or the inflammation of the lining of the intestines, which is usually caused by bacteria or virus. So there are a few honorable mentions. Definitely the list does go on. All of these were mentioned in the holy text or by the Prophet himself. And all of them have shown to be positively impact gastrointestinal health. For example, dates. As Ramadan approaches, we're eating quite a lot of them. They are very high in fiber and great source of dietary fiber. They aid in inflammation and constipation relief. Grapes were mentioned several times in the Quran, mainly as an example of the fruits that Allah has blessed us with on earth. Grapes contain a plethora of flavonoids, and studies have shown that grapes have hepatoprotective properties or liver protecting properties. The polyphenol compounds in grapes have specifically improved liver health and aid in the prevention of abnormal retention of fat in the liver. Black seeds or nigella seeds also improve gut health. A 2016 study has shown that certain compounds in black seeds also have hepatoprotective properties and effects against GI diseases. Barley and oats are a rich source of soluble fiber, and they act as food for your good gut bacteria and lower cholesterol levels. Fenugreek does relatively the same thing, and mushrooms are rich in carbohydrates, which make them a good choice for prebiotics. So moving on to the lifestyle of the Prophet. Many of the habits and avoidances are reflected in modern life and modern medical practice today. For example, it is known in the Islamic faith that the consumption of alcohol is strictly forbidden. In relation to GI, excessive alcoholic drinking damages the liver and may lead to alcoholic hepatitis and cirrhosis. Alcohol consumption also increases gastrin levels and acid secretion of the GI tract and affects absorption and bowel movements. Alcohol also encourages the development of various cancers of the GI tract, such as oropharyngeal cancer, esophageal cancer, gastric cancer, liver cancer, and colon cancer. The way that Prophet ﷺ also ate contains scientifically backed benefits. The Prophet ﷺ ate slowly and warned his followers not to eat in excess, and the Prophet ﷺ used to never eat while reclining. And as mentioned by Dr. Nagamia, probably one of the most popular or well-known hadith about food consumption is when the Prophet stated a human being fills no worse vessel than his stomach. It is sufficient for a human to eat a few mouthfuls to keep his spine straight. But if he must fill it, then 1/3 of food, 1/3 for drink, and 1/3 for air. So excess food, as well as having bad posture while eating or eating while reclining, can cause pressure buildup on the valve that separates the esophagus from the stomach, and that's depicted in the diagram here, which thus increases the likelihood for the contents of the stomach to travel back up and lead to acid reflux, heartburn. Similar effects are, like I mentioned, seen while reclining, if you're eating while reclining. Another example is intermittent fasting. While this current trend is gaining traction in the everyday Western lifestyle, this practice is not a new phenomenon and has been evident in the Islamic faith and the Prophet ﷺ's lifestyle, whether it's Ramadan or fasting every Monday and Thursday. So as Muslims, we are quite familiar with it ourselves. Intermittent fasting produces a multitude of benefits for the body, including gut health. So that's kind of covering a very small gist of the prophetic medicine that's related to the GI. A plethora of medical marvels and advancements were made during the Islamic era after. During the Islamic Golden Age, the period between the 8th and the 13th century, the Islamic world was brimming with scholars of medicine. Excuse me. Works of these scholars contributed to the foundations of modern medicine today, with their translations of books from Hippocrates, Galen, Aristotle, to their own publications of their medical texts. These medical texts were not only revolutionary in the Islamic world, but also influenced the Western medicine we know of today. Many of the scholars at the time became pioneers in surgical practice, pharmacy, and therapies. So the scholars that I mentioned will be in relation to the GI, and they're in no particular order. So we'll start off with Al-Razi. Al-Razi is a Persian scholar, and as with many scholars of the time, they were basically a jack of all trades. His influences are seen in medicine, physics, chemistry, mathematics, pharmacology, philosophy, just to really name a few. In regards to gastroenterology, Al-Razi dedicated a chapter to the subject in one of his many books, Kitab al-Hawi fil-Tib, or the Comprehensive Book on Medicine. This photo here that I have next to his portrait is a page from a section on gastrointestinal diseases. So it's basically like a table of context. The first line of the page, which is written in Arabic, is an invocation to God, and the sentences after provide an outline of the contents. What we can deduce from here is that Al-Razi explored treatments of hemorrhoids, pediatric dysentery, anal fissures, etc. Aside from anal rectal diseases, Al-Razi also described the anatomy of the organs in the digestive system. In one of the sections of the book, Al-Razi corrects Galen, an esteemed physician, surgeon, and philosopher of the Roman Empire, on his description of the stomach. Al-Razi believed that the stomach has 3 distinctive layers: oblique, longitudinal, and circular, as opposed to Galen's perception of 2 layers. And we know that today Arazi's beliefs are held to be true. In another section, Arazi also details gallbladders, cystic duct, hepatic ducts, and common bile ducts, as well as hepatic veins. When discussing anorectal diseases, Arazi documents a challenge he faced while treating such diseases, stating that they were especially tedious to treat and heal due to the fact that the area is easily contaminated and is susceptible to a lot of sensitivity and pain. With regards to hemorrhoids, Arazi believed that hemorrhoids occur in conjunction with the swelling of rectal vessels due to buildup of pressure that's caused by the liver sending what he described as impure venous blood to the area, which caused the hemorrhoid to swell up as well. So similar findings are held true in modern medicine today. Liver cirrhosis and portal hypertension increase the occurrence of hemorrhoids and rectal varices in patients with these conditions. Arazi would then go on to distinguish hemorrhoids and intestinal ulcers by asking the patient if they pass a lot of stool. If the patient did, then Arazi would determine that they had an ulcer as opposed to difficulty or pain passing stool or constipation, which he would then determine it would be a hemorrhoid. And then in one documented case, he would treat the ulcer with a fennel enema. In terms of treatments of hemorrhoids, Arazi listed prescribed natural remedies such as a concoction of certain animal and plant fats. This mixture can be modified with the addition of certain seeds, and I've read as well iron rust, among other herbs and plants. Arazi also suggested placing boiled leeks baked in cow fat over the hemorrhoids, as well as smoking the hemorrhoids with leek seeds, caper root, and bitter melon root, all with hopes of reducing the swelling. With regards to more invasive surgical treatments, Arazi suggested a few types of interventions. The first being ligation, using either a silk tie at the base of the hemorrhoid or using twisted fibers attached to a needle. And this is comparable to the modern day technique of rubber band ligation, which is the diagram I have here. Another surgical procedure mentioned is excision. Excision was done simply by removing the hemorrhoid at its base and treating the surgical site as wound care. Arazi prescribed a few different treatments to ease pain associated with these diseases. They mainly included enemas, which were made of egg-based mixtures and suppositories composed of camel hump fat and other oils, and suppositories made of cotton soaked in honey and black seeds, and the oral consumption of apricot, honey, and juniper. A lot of his natural remedies did include black seeds and honey. So kind of mirroring what we discussed earlier. Other hemorrhoid treatments suggested by Arazi included lifestyle modifications and sitz baths. He also paid close attention to the possibility of damaging the sphincter in these processes because he had the understanding that the outcome of damaging the sphincter would lead to complications such as incontinence or excessive bleeding. In terms of rectal prolapses, Arazi specifically wrote that loose anal sphincters brought by tumors or weakness in the area cause a portion of the rectum to protrude. So he believed remedies such as suppositories and sitz baths were necessary, and those two had to specifically contain an astringent. Another surgical intervention would be the way he treated anal fistulas. He surgically treated them by scraping the fistula tract until it shrank in size and placing what essentially is a plug made up of porous material that was soaked in frankincense and aloe vera. So here we have two illustrations. So one on the left of is from the 15th century. It's a Turkish illustration that depicts the treatment of hemorrhoids through tying an excision. So like the historical medieval rubber band ligation. And then on the right is just a picture of what a sitz bath would look like. This specific one is a miniature of a public bath or hammam painted in the 17th century. So moving on to our second scholar, Ibn Sina. He was a Persian physician and scholar of multiple disciplines as well as being a surgeon. He, like many of his time, studied a plethora of other subjects. In his case, those subjects were mathematics, politics, astronomy, philosophy. However, he is widely referred to as the founder of the world of medicine and one of the greatest physicians to have ever lived. In his lifetime, Ibn Sina produced 5 medical books in his collection, The Canon of Medicine, and in his 3rd volume, he specifically focused on the GI. He details his theories, his own discoveries, and diagnoses of diseases related to the GI tract. I found this pretty interesting when I came across it. Ibn Sina essentially laid out the foundations for modern gastroenterology. He's referred to as the first to rely on reflected light to observe body cavities, which is a practice that marks quite a pivotal moment in modern day endoscopy. So he has different procedures that outline that. So he was also one of the first medical scholars to draw a connection between the stomach and neurology. Ibn Sina believed that gut distress was a cause of neurological disease, writing that the stomach is involved in head disorders, in many head disorders. GI disorders can cause neurological disease, but not vice versa. So Ibn Sina's hunch centuries ago has proven to have merit in today's world. The gut-brain axis, or the gut-brain theory, is a modern theory that suggests that the microbiome of the GI tract has important interaction with the central nervous system. For example, there are studies that have shown that inflammation of the nervous system can originate from the GI tract due to infection from pathogens such as H. pylori. H. pylori not only can reach the brain, but can also affect the brain by inducing detrimental inflammation through inducing itself cytokines and chemokines. In his work, Ibn Sina also offers details and of the symptoms of gastritis, or inflammation of the stomach lining, as well as gastric ulcers. Ibn Sina also developed a method to locate an ulcer through the use of pain and the arrival of that pain. So Ibn Sina believed that the pain of an ulcer occurs when the ingested food reaches that ulcer, and thus its relative location can be determined. He also used oral health as an indication of the presence of a GI illness. Similar to Al-Razi, Ibn Sina described anal fissures and their causes. He also shared similar remedies, including sitz baths and surgical procedures. Also similar to Al-Razi, Ibn Sina dedicated portions of his book to describe observations in anatomy. With regards to the liver, he specifically stated that its physical appearance was red and resembled like a coagulated blood and contained no nerve fibers. He stated that the liver's function was to receive chyle, which we know today as fluid consisting of fat and lymph, from the other digestive organs, and then he would go on to say that this chyle is then cooked in the liver and transformed into blood that is transported throughout the body. He also believed that the liver sent various other fluids separately to other organs, like water to the kidneys, yellow bile to the gallbladder, black bile to the spleen. And clearly what we can see here, that it's very early thoughts regarding to what we know today of liver's filtering properties and its production and excretion of bile. So here are 2 different illustrations from a Persian manuscript that shows the organs of the digestive tract. Both of these have similar organs listed, and they there's little words that kind of dictate the captions or the names of the body parts. So the Canon of Medicine also contained detailed descriptions and treatments of small and large bowel obstructions. With regards to bowel obstructions, Ibn Sina believed that there were 2 root causes: intrinsic and extrinsic. Intrinsic causes of bowel obstructions included loss of muscle activity in the colon wall, inflammation of the intestinal wall, which we can now infer as Crohn's disease, twisting of the bowels, herniated bowels, fetal infection, that sort of thing. And then extrinsic causes of the bowel obstructions included inflammation of organs surrounding the intestines, such as liver, spleen, bladder, kidney, as well as kidney stones. He also listed the consumption of certain foods, like greasy or really sweet foods, opium intake, and dehydration as causes of bowel obstructions. Ibn Cena documented his own observed symptoms of bowel obstructions as well, and he included them as nausea, vomiting, persistent abdominal pain, thirst, bad breath, epigastric pain, constipation. And in severe bowel obstruction cases, he noted symptoms of palpitations, cold extremities, cold sweating, and altered mental status. He was pretty much accurate in describing the causes. Some more that we know of today include adhesions and tumors, and he also had an understanding that bowel obstructions could lead to fatalities as well. Now moving on to our next scholar, Az-Zahrāwī, often referred to as one of the most famous surgeons of the Islamic era. In his lifetime, Az-Zahrāwī produced the book, The Clearance of Medical Science for Those Who Cannot Compile It. In his work, he dedicates portions to discussing the procedures of paracentesis to treat ascites and intraperitoneal abscesses. For example, in 2 chapters, he detailed the use of cauterization, the process of burning the skin or flesh with a heated instrument to alleviate hemorrhoids, periannual fistulas, hernias, and to drain liver abscesses. And we'll take a look at that in a little bit. Az-Zahrāwī also provided clinical observations about the outcomes of intestinal wound healing, depending on the location of the wound. He believed that wounds in the colon healed the fastest compared to wounds of the ileum and the jejunum. He noted that wounds in the latter were unlikely to heal and most often produced a fatal outcome. So this is a sketch obtained from Az-Zahrāwī's book of a cautery that's used to drain liver abscesses specifically. After being heated, the instrument was pierced directly into the abscess. The rounded portion that we see here is an addition meant to retain the heat of the tool and help prevent hemorrhaging as the instrument passes through the abscess. Here on the left, we have a circular cauterization tool used primarily for stomach ailments. And on the right, we have cauterization tools for hernias. On the left, we have a sketch depicting the ink markings that are used in the process of cauterization. And then on the right, we have very simple drawings of Az-Zahrāwī's anorectal surgical instruments. And as we can see here, that includes scalpels, enemas, probes, that sort of thing. So Az-Zahrāwī also mentioned a surgical procedure to treat femoral hernias specifically. And then he described that condition as a hernia in the groin that doesn't result in the intestines protruding into the scrotum. So he had a very clear understanding that location dictated different types of diagnoses, and that this procedure involved making an incision directly where the hernia is to expose the peritoneum. He used a tool similar to a rod to press the hernia back into the abdomen. This rod was then to serve as a guide for stitching up the peritoneum afterwards and finishing off the procedure and then treating it as wound care. A significant intersection between all 3 mentioned scholars so far in their research is their documentation of inguinal hernias. Inguinal hernias occur when the tissues, such as part of the intestinal tract, protrude through the abdominal wall. Ibn Sina, for example, described his version of a hernia reduction procedure that was non-surgical as an alternative. His instructions included laying the patient in a supine position and placing a warm towel on the hernia site while relying on softener medications to kind of, I guess, use gravity to let the hernia fall back through. And then Al-Razi just documented similar approaches. However, Az-Zahrawi had both non-surgical and surgical hernia reductions. He believed that inguinal hernias were caused by physical trauma, lifting heavy weights or jumping, and even shouting. He treated hernias non-surgically, as I mentioned, but also detailed surgical treatments. One of the methods he was known for was the cauterization mentioned before. So in his book, Az-Zahrawi begins by stating that the patient should be prepped a day ahead of time by abstaining from food, and they should focus on emptying their bowels through the use of what we now consider as laxatives. So it's his own version of a bowel prep. For the surgery, the patient was to lay flat on their back with their extremities held down by assistants, and then the patient is then to hold their breath while the physician maneuvers the herniated intestine back into the abdomen. Afterwards, a mark is drawn with ink under the hernia, so similar to the marks I showed previously, the cauterization marks. And then after the cauterization tool is heated appropriately, the physician pushes the hot tool onto the marking that was made until it reaches the pubic bone. Post-procedure care included bed rest for the patient for at least 40 days. And he specifically stated that the patient must remain on their back. And then consumption of soft foods only, wrapping the incision site across the abdomen and treating the burn site. Another method Az-Zahrawi practiced was a surgical operation in which he had the patient lay on their back, and the physician would make an incision in the scrotum deep enough to separate the testes from the tissue. The physician then essentially pushes the herniated intestine back through the inguinal canal using their finger. The inguinal canal is subsequently stitched closed. It appears as though the separated testes was then removed in the procedure, along with a portion of the spermatic cord. Post-operative care for that included placing a piece of wool doused in oil where the gap was formed. And then, like in the previous post-operative care, the abdomen and groin were wrapped in many places to prevent further prolapsing. And then he detailed some side effects of these procedures, like complications such as prolapsing of the intestines, once again, intestinal damage, severe hemorrhaging, as well as fatality. All right. So our fourth scholar is going to be Iden Zoho. He was one of the most distinguished physicians of Muslim Spain, and he came from a 6-generation long family lineage of physicians. And Iden Zoho served as a court physician as well and produced multiple medical sources, most notably a book titled The Book of Facilitation on Therapeutics and Dietetics. A section of the book quite possibly contains the first documented clinical observation of colorectal carcinomas in medical history. He described a case study. So the case study was when he encountered a patient with an abnormal finding. He described the patient's symptoms, aside from the presence of the tumor, as inability to digest food, presence of an irregular fever, irregular in terms of intervals and severity, complaints of body weakness that would come and go, diarrhea, and presence of blood in their stool. Upon physical examination, Iden Zoho observed the presence of protrusion the size of an apple located in the hypogastric region. Iden Zoho noted that the patient did not complain of any pain that radiated from the tumor's location specifically, but did feel pain when the physician would press on the protrusion. Iden Zoho understood that the patient's current state and condition was fatal, and he opted to treat the symptoms as best as he could. In his notes, he did mention, one moment. In his notes, he did mention that he believed that eating certain foods was a probable cause for the tumor. At the time, the patient and Ibn Zoho were living in Morocco, where the Berber population consumed a lot of cured camel meat. Ibn Zoho believed that the consumption of this cured meat increased the symptoms and was ultimately a large contributing factor of the disease. This finding was quite interesting to me because when I was doing my own little research on this, there's actually scientific evidence that suggests that camel meat may actually have the opposite effect on GI health and may be anti-carcinogenic altogether. However, it is well known that an increase in red meats and cured meats, for that matter, are correlated with an increased chance of colorectal cancer. Whatever the case may be, Ibn Zohar highlights the importance of diet and its influence, both negative and positive, on the development of cancer and other diseases in the GI tract. He was also one of the first to practice direct feeding through the throat in those cases where normal feeding wasn't possible, and that's very early research or use of feeding tubes. Okay. So moving along, we have Elashad. He's an Islamic medieval physician based in what was now considered Iraq, and said to be one of the first, if not the first, to perform experiments regarding gastric physiology. He details these experiments in his book, The Judge and the Follower. In it, he states, when food enters the stomach, especially when it's plentiful, the stomach dilates and its layers get stretched. He observed that this in a live lion, which he dissected. Some onlookers thought that the stomach was rather small, so he proceeded to pour water into the lion's mouth and continued to pour jug after jug in its throat, and then counted until the stomach filled up with about 4.7 gallons. The inner layer of the distended stomach became as smooth as the external peritoneal layer. He then cut open the stomach and let water out, and the stomach shrank, and he could see the pylorus. So this, the physiology of the human stomach is well known today. However, the experiments that were conducted by Elashad essentially the groundwork for future observations and experiments to come. Last but certainly not least, At-Tabari was the 9th century physician based in modern-day Iraq and Iran. His book, Firdaus al-Hikmah, Paradise of the Wisdom, is considered one of the first medical encyclopedias. He drew upon all sources of medical information from Greek to Persian to Indian and Arab. It is one of the sources that influenced many of the physicians of the time of At-Tabari and after, including Al-Razi himself. What sets At-Tabari apart was his focus on Greco-Arab medicine, also known as Unani medicine. Unani medicine is a form of alternative medicine that focused on the Hippocratic theory of 4 humors: blood, phlegm, black bile, and yellow bile, as well as the 4 states: moist, dry, hot, and cold. At-Tabari dedicates a few chapters on the stomach and liver issues, in which he states observations such as excess food and water becomes poison to the body, flatulence may be caused by eating dry food, inducing constipation, and that the consumption of grain with the husk can also cause flatulence. So this is echoing what we know as gluten intolerance today. He discusses the symptoms of diarrhea as well: weakness of the body, pain in the upper and lower abdomen, and can even be caused by fear. Today, there are numerous studies that prove that this link between anxiety and increased bowel movements, especially with regards to irritable bowel syndrome, hold to be true. And with that, we wrap up the presentation. We discussed portions of prophetic medicine as it pertained to digestion and nutrition, as well as explore the historical advancements by our Muslim medieval scholars. Throughout this research endeavor, we did come across a few challenges. Some of my research was limited due to inaccessibility of a lot of these books mentioned for various reasons, like untranslated copies or unrecovered books or limited online access. A lot of conflicting information was online, so deducing the most accurate rendition of these scholars' works definitely was necessary and took time as well. We also noticed that compared to other fields, the GI and liver didn't seem to exhibit as many findings, and that could be a reflection of the inaccessibility of these books. However, I have grown a huge appreciation for my ancestral history through this and through listening to previous presentations put forth by the organization. So I hope we're all able to learn a thing or two. And with that, I think we can open the floor to Q&A.
Okay, wow, that was amazing. SubhanAllah, like I learned so much from that. Two things was our beloved Rasul Sallallahu Alaihi Wasallam, magnificent, timeless advice for us living at any given time. When I'm in the hospital, 10 to 15% of my census is alcohol-related illnesses, whether it's GI bleed or what have you, thrombocytopenia, etc. So our beloved Rasul Sallallahu Alaihi Wasallam always with the best advice and hadith. Alhamdulillah, I'm grateful for that. And then the second thing, just 2 weeks ago, I had a patient with a liver abscess that we drained. And if you think Al-Zahrawi was contemporary to 900, 1000 CE, that's 1,000 years ago that was being done. So subhanAllah, you know, the guy I sent to IR to get the drain or to have it drained, alhamdulillah, like they were doing that almost 1,000 years ago. So amazing content, a lot to reflect on there. Even paracentesis almost 1,000 years ago. That's pretty impressive. I had no idea. We have one question from the audience I'd like to get to. What's the importance of intermittent fasting on your health, especially during the month of Ramadan?
Thank you so much for asking the question. Thanks, Widad, for a wonderful and excellent presentation. I think you did a great job. And I would remind our viewers that all the presentation which has been presented today is not the total part of it, okay? Because in the time constraint, we can only do a little. And I would refer everybody to, inshallah, when the book chapter will come out, hopefully at the end of this year, to please look into the book chapter, which has all the detailed information about all the presentations today and also the references. So to answer your question, Dr. Shahab and the viewer, I think this is the most important thing actually I want to discuss today, especially in the month of Ramadan, which is coming in the next few weeks. And now more and more people are realizing the importance of intermittent fasting, because Ramadan is what? Intermittent fasting, right? The definition of intermittent fasting is that you fast for a certain number of hours during a day, 6 hours, 8 hours, 10 hours, 12 hours. And then you eat, and then you go through this cycle for weeks or months at a time. So that's the modern definition of intermittent fasting, which is exactly what we do in the month of Ramadan for all these many years since our Prophet has told us. I also recommend our viewers to go into this great paper, which is published recently in the New England Journal of Medicine. Now, the New England Journal of Medicine is the most renowned paper in the field of medicine. And this article actually published in December of 2019, so like few months ago. And the topic and the title of this paper is the importance of intermittent fasting on general health. So after all these years, we have been doing, the Muslims have been doing during the month of Ramadan. This has been, of course, we know that it was important to us, and I will go over the details in a second. But now it's been verified and supported by the medical literature, and which was published in this great journal and in this great paper. So I'll just summarize the 4 or 5 points. What happens when we do intermittent fasting, or when we do Ramadan, when we do Rosa during the Ramadan. So the most important thing which happens that when you don't eat, you decreases your glucose burning, right? Because your insulin level goes down. When your insulin level goes down, you start burning your glucose. Instead, you start burning your fat, which is called lipolysis in medical dictionary. And what happens that when you start burning the fat content which is contained in the adipose tissue which means the fat part, mostly in your abdomen and other part of the organs, you start burning that fat, which is called ketosis. And when you start burning the fat, of course, this is beneficial for you. And the fat, the content of your body overall goes down, and it will help you in losing the weight. So that's the most important thing. And all of this point, which I'm mentioning now, has been proved by the medical literature. And they have done several human and animal studies which have proven this point. The second thing which intermittent fasting does is that it decreases your insulin resistance. So people who are diabetic, we know that type 2 diabetes happens when you have insulin, you don't have deficiency, but it doesn't affect the organs, so that your glucose metabolism is impaired. So when you do the fasting, the resistance of the insulin goes down, which helps in the glucose metabolism in patients who are diabetic. The third thing is that it increases the longevity. And it increases your life. How it does that? Because your body goes through constant remodeling, right? And the cell turnover and the dead cells have been disposed of, and the new cells start growing. So when you start doing fasting, it basically acts as a trigger for this mechanism where you have the increased cell turnover, and your body goes through remodeling, and that increases your longevity. This was seen in the animal models, especially in the rats, and it was proven that the rats who were subject to fasting, intermittent fasting, have a longer life as compared to the rats who were not going through the fasting. Human studies are still needs to be done on this subject. The fourth thing is that it increases your growth hormone. This is a special kind of a hormone which helps in your body growth. It helps in your glucose metabolism and also the fat metabolism. So the increased growth hormone can increase your metabolism. And then, of course, we know that once your metabolism is increased, you lose weight, right? So all of those things point to the factor that there are multiple several benefits from different paradigm, which helps in the longevity, increase weight loss, decrease glucose metabolism, increase fat metabolism, and cutting down on the fat content of the body. And the last thing which also mentioned is that it improves into your blood pressure, your diabetes, and also Widad mentioned, and I want to come on this topic in a second also, about something what we know now is called gut microbiota. All right, so gut microbiota is a new concept which is in the last 4 or 5 years in the field of GI has been taking a lot of importance, because we know that your gut, your colon, is full of good and bad bacteria, right? And there has to be in a harmony where these bacteria live together so that you have no symptoms of the gut. When you start doing fasting in there, the content of the bad bacteria goes down and the content of the good bacteria goes up. So that's also been proven in the animal studies during the intermittent fasting time. Of course, once you have this microbiota in a good shape, it affects overall your system, as Widad mentioned, gut-brain axis, which I can talk more if there's a question in the future. But just to summarize, all these factors we knew many, many years ago. As Muslims, we were fasting and we know the effect now has been validated and now has been proven by the medical science and published in New England Journal of Medicine. And this paper is available online. I recommend actually everyone to go New England Journal of Medicine and look into December 2019 paper. This is a free paper.
We'll post a link to that hopefully in the YouTube.
Yes, please. Yeah, that will be. Thank you.
Awesome. Thank you for that. So much I didn't know about intermittent fasting. So we had one more question. At least I wanted to get to one more question before we departed. Can you explain the importance of gut-brain axis as mentioned in your presentation? If you could briefly summarize as quick as possible, what is the gut-brain axis?
Sure, absolutely. So as Widad mentioned, that one of the scholars mentioned about the gut-brain axis, Ibn Cena. So Ibn Cena has done a lot of work almost 1,000 years ago, right? And now we are looking into, and the medical science again is the same concept. It's been proven it now that the gut-brain axis is what. So basically, what we have learned in the science now, in the literature, that in the gut, as I was mentioning earlier, in your colon, in your small bowel, is a concept of a bacteria which are called microbiomes. Okay, I'll make it very simple so everybody can understand. Now, these microbiomes, they interact with the nervous system in your gut. And then this nervous system in your gut directly links to your brain. So this is how there is a direct link between your brain and your gut, which is the bacteria inside your colon. So such a novel concept, which Ibn Razi, al-Razi mentioned thousands of years ago, but now it's been proven to life. So what happens that this bacteria is a two-way communication from the brain to the bacteria and bacteria to the brain. And this keeps us in the harmony. So if there is a disruption of this gut-brain axis, you will have diseases which are very common. I'm sure everybody knows about IBS, Irritable Bowel Syndrome, right? So this gut-brain axis is compromised. Either you have more bad bacteria or you have less good bacteria, right? And then the triggerer and the signaling from the bacteria to your nervous system, which affects your brain and then affects the neurotransmitters, it affects your mood. So if somebody is having GI symptoms, GI disorders such as IBS, Irritable Bowel Syndrome, we treat them nowadays with other medication, antidepressants. And this has been now validated, FDA approved, that a small dose of antidepressant, which has no effect in your gut, it affects your brain, but indirectly it affects your gut, and the vice versa. Such as if you want to treat the gut part of it, we give them probiotics, right? So the probiotics are the good bacteria, and which, as I told you, that we want to get the good bacteria level high and the bad bacteria level low. So in this way, this gut-brain axis triggers so many diseases such as Irritable Bowel Syndrome, gluten intolerance, and now we are treating more and more towards the physiological aspect of it. And now it's been proven. So I think that's amazing that our scholars have mentioned this so many years ago. Now the medical science has proven it. Thank you for that question.
Oh, absolutely. You know, when people say trust your gut, what does your gut tell you?
Right, exactly.
There's nothing like neurocognitively you can correspond to, you know, that there is something about trusting your gut. So that's a very deep and great answer. I wanted to get to one last audience question from Mr. Mahmoud Mohiuddin.
Sure.
He asked, what was the anesthetic agent used for surgeries during the Islamic medicine period? Was that as efficient as the general anesthesia gases used today?
Widad?
Okay, yeah, great question. In regards to Al-Razi, who used the astringents for the sitz baths, he used rose oil, sumac, and he mainly used it to relieve dryness of the area and then subsequently any discomfort. In terms of the surgical procedures, like a Zahrawi, a lot of the anesthetics at the time were different herbal remedies like the opium plant, black nightshade, Indian cannabis, and they were used before the surgery, so pre-op, either inhaled like a gas or ingested orally. Definitely not necessarily as effective as anesthesia today, and that was noted especially in how the scholars were very specific to recognize that fatality was a result of these surgeries as well, or could be a result of these surgeries because the pain is so unbearable, and even the post-op pain as well. So.
Oh, wow. Wow, that's very interesting that they were using opium for some of this anesthesia. That will hopefully wrap up our Q&A session. Looks like we don't have any more questions at the moment. Jazakallah to all of our presenters, Dr. Adnan Muhammad. Fascinating and very timely input on intermittent fasting, gut-brain axis. There's so much more I could read about this. Sister Widad, I know you're going big places after this presentation, mashallah. That was very thorough, and I'm going to definitely do more research after this to learn more about those amazing scientists. And whoever was on the call, forward to your friends. This will be online for, inshallah, for a long time. So this will be hopefully a repository for anybody looking to learn about gastroenterology, health, in medieval time and sciences. So the live portion's done. It's going to exist in the cyberweb for time now, so you can send it. Keep sending comments. Dr. Adnan's on there, Widad's on there, I'm on there. Keep putting comments on there or questions. We're still available through that. So we can still continue this discussion on either Facebook or YouTube. Please subscribe to the YouTube channel and the Facebook channel for further updates. We have our next topic, which will likely be after our own real intermittent fasting after Ramadan. We're going to have a conversation on transplant medicine, inshallah. Just one person I forgot to mention earlier, Sister Rabia Khan has been coordinating all those IT things today, and it was very smooth. Jazakallah for your help. To everyone, please, thanks for tuning in. Like I said, the conversation has not ended. This is an ongoing series that we'll have every month or 2 months. So we appreciate everyone being a part of today's presentation. Jazakallah. All right. Assalamu alaikum.